Hi, I'm Diana Hernandez, Communication Assistant for the City of Enid, and this is another COVID-19 update, Pediatric Edition. With me, special guest is Dr. Eve Switzer, pediatrician with Northwestern Pediatrics.
Northwest Pediatrics, that's right.
Yes, thank you so much for taking time to be here. I know this is a very busy time for you, and I know that, like you and everyone in the medical field, are working overtime. And thank you for what you're doing for the community, for families, for children. And I know that what you're going to bring is going to put a lot of people and a lot of parents at ease. So thank you very much.
Sure. Yeah. So just by way of introduction, my name is Eve Switzer. I've been a pediatrician here in Enid for over 20 years. My partner, Dr. O'Quinn, and I are at Northwest Pediatrics. We have an outpatient clinic, and then we also cover the inpatient services at both St. Mary's and Bass. So we take care of the nurseries as well as any pediatric patients on the floor. So the first thing I wanted to mention, I appreciate the opportunity for being able to come out here and share some information. So when I actually spoke to the mayor first a little bit about the importance of pediatrics and not forgetting the children and the importance of pediatric care right now. So that ended up with me being here today. So I wanted to just mention that this entire process has been a very, very fluid process. It's a dynamic sort of situation that we're in, and I think that the information that we've been receiving for the last couple, 3 weeks or so has been extremely fast in how it's coming out. So most of the information I'm going to present today is going to be really information that we know of to the best of our current knowledge. So there may be some data that I'm going to present that could be changing over the next few days or so. It used to be 2 weeks ago, it seemed like it was changing every 15 minutes.
Yes.
Now it's a little bit slower, but we still are learning something every day. So the best source of information, the most reliable, up-to-date information you're going to get is going to be from the Centers for Disease Control, the CDC. And then for anything pediatric related will be really the American Academy of Pediatrics, the AAP. So I basically wanted to start off with some information just about the coronavirus itself, just to kind of give us a basis for some of the things that we're going to go over today. The coronavirus, the COVID-19 is the name of the disease. So it's caused by a particular virus, and the virus is SARS-CoV-2. And what that stands for is that it stands for Severe Respiratory Syndrome Coronavirus Type 2. So what we have to remember is that this is actually the number 7 coronavirus that we know of that affects or infects humans. So 2 of the other types of coronavirus that is more familiar, I think, to some people is going to be the original SARS-CoV, which was which caused an outbreak back in 2004. And then we also have the MERS, which is Middle East Respiratory Syndrome. That was also caused by a coronavirus back in 2012. That was primarily in the Saudi Arabia and those areas out there. So that's the 3. Now there's the other 4 types of coronavirus. So coronavirus, actually there are 4 other strains that normally circulate that primarily it's children that's contracting these coronaviruses. It happens mostly in the wintertime and the spring, and it causes basically cold symptoms in kids. So for instance, I have seen 2 kids in the last week who have tested positive for coronavirus, and my staff was a little bit worried when they saw the results because they thought, yeah, but this is not the same thing. This is not SARS-CoV-2. These are the other 2 types of coronavirus strains that we're seeing that are currently circulating. And so these kids were coronavirus positive for a different type of coronavirus. Okay, so the picture that I have up on the slide there, everybody's familiar with this with this picture from the CDC. So basically, this is a picture of the virus, and all of those red spiky things that are on the outside of this virus is the protein that allows that virus to attach to you. So it likes to attach to a certain receptor, and these receptors are located on your epithelia. So your epithelia are like the lining of your nose, the lining of your eyes, the lining of the inside of your mouth, and also the lining of your lungs. So once those proteins find those receptors, then it connects to those receptors, and then it allows the virus to gain access to the cells where it makes copies of itself, and then it starts destroying things. So that's basically how the virus gets into you. So that'll become a little bit more important as we kind of make our way through this information. So when we're talking about a virus and how contagious it is, usually we're referring to something that we call R0, which is your basic reproduction number, and that gives you an idea of how contagious an organism is. So the R0, for now, we're looking at an R0 or contagiousness of this organism being between 1 and 3. So what that means is that if someone were to become infected with this virus, they can infect up to 1 to 3 other people. So yeah, so that I want to give a little comparison to some of the other organisms that a lot of people are familiar with. So on this slide, the COVID-19, there's going to be that 1 to 3 R0 compared to the seasonal flu, which is on the lower part of that graphic. The influenza seasonal strain, that R0 is going to be somewhere between 0.9 and 2. So is COVID-19 more contagious than seasonal flu? And the answer is yes, it does look like that it's more contagious. Now the other thing I want to point out on this graphic is that if you look at some of the most contagious diseases that we know about, one of the top diseases is measles. And just to give you a frame of reference, the R0 for measles is between 12 to 18. So when you are infected with measles, you can infect up to 12 to 18 other people. So that's quite a bit more contagious than SARS-CoV-2 is. So the other thing I wanted to mention on this graphic is that if you look down the middle column, it tells you the mode of transmission. So we have basically 2 types of transmission. We have one that is considered airborne and one that's considered droplet. And I wanted to explain a little bit about the difference between this, because I think it explains a lot about why we're being asked to stay apart from each other and where that 6-foot distance comes from. I think if people understand that, then it's a little bit easier to try to do that social distancing. So here's a graphic that I stole from somewhere that I think explains it very, very well. When you are even speaking or breathing, you are expelling droplets out of your mouth and out of your nose. And so those droplets are fairly large droplets, and so, but you can expel them out and they'll land on surfaces or on people as far out as about 1.5 meters according to this graphic, which translates to be about 4 feet. So if there's coughing behind that, you can expel those droplets out to greater than 2 meters, which is greater than 6 feet. So if you're sneezing it out, you can go all the way out to 6 meters, which is about 20 feet. Wow. So people who are actively infected can share their droplets more than 6 feet. So you want to be very, very careful about exposure in the face of somebody who is acutely infected or has symptoms of infection. But even like you and I talking to each other, there's going to be some droplets spread just from me talking to you, and you keeping your distance 6 feet back, tries to protect you from those droplets falling out. So it's a very unnatural thing to do. So I've been talking about it with my staff at my office, with the staff at the hospital, because we're very, personally, I'm uncomfortable with doing that social distancing because it just feels impersonal and it feels unnatural. But we have to make a concerted effort to make sure that we're keeping those distances so that we can keep from passing those droplets on. Okay. So the other information that I wanted to share is basically the contagiousness and mortality associated with this disease. So this is a graphic that I pulled off of the grand rounds from Seattle Children's Hospital that they had at the end of last week, because I thought this illustrated, just to kind of give you a basic understanding of where we're at with this particular organism. So on the y-axis of this graph, there's going to be a fatality rate. And then on the x-axis of this graph, you're going to have the number of people that can be made sick, or the contagiousness. So what you'll see up at the very, very top left-hand side of this graphic is the bird flu, which is a very significant, severe disease that causes a lot of mortality. On the other end of the scale, you're going to see measles, which is all the way on the right side, because as we already talked about, it's a very contagious organism. Yeah, so probably one of the most contagious and deadly diseases that we've ever seen is smallpox, and you'll see that up in the upper right-hand corner of this graphic. So seasonal flu is towards the bottom on the left side, so somewhat contagious, some mortality, not nearly as much as smallpox or bird flu. But what we're finding with the current data that we have is that coronavirus, SARS-CoV-2, lives in that pink box that's right there. So definitely more infectious than seasonal flu, probably more mortality or death associated with this organism.
Okay.
So talking about infection in children, you know, so most of those diseases that are listed on that previous graphic, a lot of those we have vaccines for, and primarily we're vaccinating children for these diseases because they are the ones that are typically at the highest risk. So it's usually your ends of the spectrum, over 65, under age 5, that are going to be at the greatest risk for a lot of these diseases. Well, the good news is that with SARS-CoV-2 or COVID-19, we're going to be seeing kids, they can get this infection, but they're not nearly as sick as as many of the adults are. So the disease tends to be far less severe in children, and you're seeing far less mortality associated with it. You know, so that's nice for us as pediatricians because we're usually the ones dealing with the sickest ones. Yeah, but in this instance, that gives us a lot of relief that the patients that we're taking care of, even if they contract COVID-19, that they haven't been as sick. Mayor Pankinen asked me to talk a little bit about vaccines associated with COVID-19. There are, latest that I read is that there are over 35 companies, labs that are currently working on a vaccine. So what's interesting about vaccine development is that some of the other coronaviruses that I already mentioned, the original SARS and the MERS, back when those outbreaks were happening, they had already started doing some of the development for vaccines against those organisms. So because those ones weren't as widespread, a lot of that research got sort of shelved, you know, and so now we're bringing out this research again. So we've actually got a little bit of a head start when it comes to making a vaccine. But realistically, vaccine approval is very, very long process, you know, so it takes a while for it to go through the different stages of testing, and then even after the stages of testing are completed and we find that the vaccine is safe to give to a large population and gives us the effect that we want, then we also have to answer the question of who's going to be the best candidate to get it, when should it be administered, how many doses need to be administered. So all of these questions really need to be answered before a vaccine is rolled out. And realistically, we're probably not going to see anything for at least 12 to 18 months. So I don't expect to see a vaccine become available probably until late 2021 or even into 2022. So I wanted to touch a little bit about medication for treatment of this organism. Yeah, it's not my forte because this goes outside of my my realm of influence and outside of my box. But just to mention what I've read about the last few weeks, there are several medication candidates, and I think this is the area where the information is just changing super rapidly. So chloroquine and hydrochloroquine, some of the medications that y'all probably have heard about in the news. What this medication does, it's a malaria medication, and it what they hope that it does is that it keeps the proteins on the outside of that virus from binding to the receptors that they need to get to. And so there's some promising results that they're looking at with that. Remdesivir is an antiviral medication that has not been approved by the FDA yet, so it's something that is out there, somewhat available. The data for all of this stuff is just lacking. We just don't have enough data to be able to say with confidence that this is the best way to treat X, Y, and Z. So I've also read a little bit about something called convalescent serum therapy. So those people who are infected with coronavirus or COVID-19, once they've recovered and your body has had a chance to make antibodies, they can take your blood and try to distill out some of those antibodies so that they can be passed on to people who are severely sick. And that looks like it's a promising avenue to use for people who are critically ill. One last thing I just wanted to mention, because there's been a lot of questions about that in my office, has to do with the use of ibuprofen. A non-steroidal anti-inflammatory drug. The FDA has put out a statement this week stating that there is simply not enough data to say that it is unsafe to use ibuprofen in the face of coronavirus. So I can say with confidence to my patients that I like ibuprofen. I use it a lot. I recommend it a lot. I will continue to go ahead and recommend it based on the data that we have now. And the symptoms in kids are very, very mild. You know, so I think that from a pediatric standpoint, I'm fine with kids using ibuprofen at this point. As an adult, you have other options. You know, so you can go ahead and use acetaminophen or some other non-NSAID medication. Okay. So what I wanted to go over a little bit about what my clinic is doing. You know, so for our pediatric patients, we are an extremely busy clinic, and so we've had a lot of patients that we've had to try to reach out to and contact to try to let them know what we're doing in our office. We're in our third week of those changes that we've made. So the very first week we made probably the biggest changes in our office, made a few tweaks last week and then a few further tweaks this week. So what we've done is based on everything that I've been able to get my hands on reading other pediatric practices, what the Academy of Pediatrics is recommending. So we've basically moved, we have two types of appointments in our office. We have either a routine visit, which is your well child checkup, 2, 4, 6, 9, 12, 18, 15 months of age. Many of those are associated with vaccination. And then we have your acute visits, which are problems, either ongoing problems or problems that just started. So in our office, we've taken all of our routine visits of our well kids, moved them all to the morning. We're only doing routine visits at 2, 4, 6, 12, 15 and 18 months of age. Those are the critical child visits where we're going to be also making sure kids are continuing to be protected with their vaccines. So the other ages that we're seeing them pretty much everything else, we're trying to reschedule for after about May or so. And then in the afternoon, that frees us up to do just acute visits. So if we need to do any sort of follow-ups or medication management, or if kids are acutely ill. We have pretty much moved our entire afternoon as of this week to just virtual visits. So we have brought in that capability of being able to do that, reaching out to parents and being able to see them, see their child, try to do an evaluation over telemedicine, and then giving some advice and being able to come up with a plan. So the other thing that we've also incorporated into our office is, you know, people ask about PPE, personal protective equipment. Every clinic, I think, in Enid is a little bit different as far as how much PPE they have. We inventoried our PPE the very first week we started talking about this, and we have some PPE which we're reserving for when cases become a little bit more widespread in our area. For right now, personally, I'm wearing a just a simple surgical mask when I'm seeing patients in the morning, primarily because I fall into that group where I think the vast majority of people fall into, is that I touch my face a lot, you know, as most people naturally do. And so a mask can help keep your hands out of your face. Yeah, and then because I'm in both hospitals and I'm also working in clinic, I have more exposure. And so you don't know until you're if you're going to develop symptoms. So the issue is that the incubation period of this disease, it can be anywhere from several days to 2 weeks. And you can actually, there is evidence that to demonstrate that you can become contagious before you start showing symptoms. So some of the information that we're seeing is that you are probably contagious at the very latest 1 to 2 days before you start demonstrating symptoms.
Wow.
And so not knowing that, and with exposures, I think that the better part of valor is to go ahead and protect my patients, because I'm getting up close to them when I'm doing their exam. And so using a face mask with my patients during their routine visits in the morning. We're asking our patients when they come in the morning for their well visits, if they're having any symptoms whatsoever, to let us know first. And then we're basically doing virtual visits and screening all of our patients in the afternoon and determining on a pretty selective basis which ones we'll need to bring in for face-to-face evaluation in the afternoon. I think that's pretty much the highlights of the changes that we've made in our office.
In your office.
Yeah.
Wow.
So I just wanted to touch a little bit, because I think from what I'm hearing, most of the medical offices here in Enid have switched to some form of telemedicine. So in order for your doctor to be able to get with you on your health concerns, I think it's important to know a little bit more about telemedicine and about things that you can do to make it work better for you. So this is the information that we're giving to our patients and parents in our office. All of our parents are being screened through our front office staff and through our nurses, and the nurses are asking or giving this advice, which is, I've had telehealth visits where a parent didn't have their kid with them, and so so it becomes a little bit more difficult to be able to give accurate advice if you don't have your child physically with you. So we're making sure that parents, when they schedule a telehealth visit, to have their loved one with them. We're recommending that they have some familiarity with how much their child weighs, what their current temperature is. The lighting in your setting is very important. I've had some parents get on their telehealth visit with me, and they have a large picture window behind them, and even on a cloudy day, that can really put a glare on the visit, and so I have difficulty being able to see their face. So we want to be in an environment that is well lit, but not a lot of backlighting. Try to close anything on your device. Most people, I think, are using their phone. And if you have an iPhone or a Samsung, it would help greatly if you closed all of the windows, the applications, the tabs, the programs that are running, so that you can make sure that your device is focused on your telehealth visit. If you have Wi-Fi that's stronger, that's going to be helpful. If you have a means of being able to communicate with an Ethernet cable, that's going to be a better scenario. Even if you have devices at home, because everybody's at home right now streaming Netflix, streaming Hulu, that if we could go ahead and turn those devices off during your telehealth visit, I think that can help with your connection. We also need to realize that there are limitations to telemedicine. There are some things that we can do and some things that we cannot do, and that that will be dependent on your physician as far as who needs to be seen in person and who can have their concerns taken care of over telehealth. Also, some of my colleagues, I was asking them about tips that they would want to share with their patients regarding telemedicine, and they said, well, make sure that patients understand that telemedicine visits are just like in-person visits, in terms of, yes, your insurance company will be billed, and yes, there may be some charges for you. So we don't want to give the impression that that's not happening. Okay, so yeah, I think that people can play a large role in trying to help out, make their telehealth visit more go more smoothly. Yeah. So there have been some other unintended consequences of our COVID-19 responses that we're having right now. So one of the better quotes that I've seen is that social distancing does not mean social disengagement.
Correct.
So from a medical standpoint, I think it's very, very important for people to go ahead and consider giving blood. It is safe to go out and give blood, and there's a high need for blood right now, because a lot of the blood drives have been, they've been canceled, so, and right now with all of the medical care that people are needing just on a baseline, even without COVID-19, I think that blood is going to be important. I wanted to say thank you for the community who has already reached out to my office manager, the hospitals, with PPE they have at home. So I've had people contact me about gloves. We've had people bring N95 masks to my office manager. Yes, so we so appreciate that. And if you have anything like that at home, that you can donate to the health facilities in town. I think that would be very helpful. One of the things from a pediatric standpoint that many of us providers are very concerned about is that this is a very difficult time. You know, everybody is stressed. We're worried about a lot of different things. We're worried about how our businesses are going to work, how if we're going to lose our job, if we're going to have to close our business down. You also have this basic perfect storm brewing, where you have parents that are concerned. Right. You have parents with children who are stuck at home. They're concerned about trying to find childcare. Correct. They're also worried about their own health and the health of their family. And one of the outcomes of that is that we may see an increase in non-accidental trauma. So non-accidental trauma, most people know that as child abuse. And so I just want to put that out there to make sure that if you have family members, if you have neighbors, if you have friends, who have children at home, they're stressed out, just reach out to them, do a checkup, give them a call, find out if everything's okay, see if there's anything that they need help with. Together I think we can try to make a difference here, but we want to keep in mind that this does put children at risk. So because there's so much surrounding parental stress, ideas, what do you do with your kids when they're at home, besides doing school stuff, kids are asking questions. They want to know what's going on. Right. They know that there are concerns that their parents have, and they probably need to have some level of age-appropriate explanation of what's going on. So I think a lot of that information is what the American Academy of Pediatrics is also focusing on. Great. So going over to their website's called healthychildren.org, and they have a ton of information there, specifically child-focused on how to cope with stress for yourself and for your kids, and then things to do to try to get through your day and the way things are right now. So I hate to leave on like negative notes, so I want to kind of leave on some positive things, So I think there have been some positive outcomes related to this COVID-19 outbreak. First, the whole idea of, are you sick? You should stay home. Well, pediatricians have been talking about that forever, and I think re-emphasizing that, which is that stay home, a child who is ill, running fever, really shouldn't be going to daycare or school. Correct. But also stay home from the standpoint that, your pediatrician or your family practice or your doctor that you use is your medical home. So not every kid who has a cold needs to be seen in a medical home, but not every kid that has a fever needs to run to the emergency department or run to the urgent care center. We are here. We have the ability to answer your questions. We have the ability to virtually visit with you if you need us to. So I think right now what we're seeing a large emphasis on, yes, stay home, but also stay in your medical home and come to us when you have questions or you have concerns, and we can get you taken care of. We've seen a huge explosion in telemedicine, which is probably in the long run going to benefit patients. Okay, so that's a good thing. There's also a renewed emphasis on how important vaccinations are. So one of the reasons that I reached out to Mayor Pankinen was because, actually I reached out to Melody, his wife, because we're in the Enid Running Club together, we play bunco together, and so I texted Melody and I said, hey, I just want to make myself available. I just want to make sure that the mayor knows that there are resources available, especially when it comes to kids. Not to forget that routine health appointments with vaccination is so important right now. The last thing that we need is another measles outbreak as a result of everything that's happening right now with COVID-19. So there's that renewed interest in making sure that children stay healthy and that there are vaccinations that are available. And then even though everybody is very stressed right now, everybody's worrying. You're worrying about your family, you're worrying about yourself, you're worrying about your job, that I appreciate the wit and the humor that's available out there right now. So some of the COVID-19 memes that are out there are some of the funniest things that I've ever seen, and I think taking that opportunity to kind of reground yourself, realize, yes, we can do some humor and some appropriate laughter, and that makes us feel better, and so I was going to share a couple of memes here that, so for those of you that have already finished Netflix, or for those of that have already shaved their eyebrows off, here are some memes for you. So I am happy to answer any questions or anything.
Yes. Okay. Now, you didn't touch much on testing, but we did talk about it before, and it was very enlightening. So can you touch a little bit about testing?
So what we were talking about before is this ability to test, and really that's on the heels of this testing that's going to be done in the community beginning or tomorrow. They're going to have that drive-through testing available. So what I was talking about is that, you know, as a pediatrician, I'm in private practice. I'm not hospital owned. I don't have a boss per se. So I can order what I need to order at the hospitals, and I could order a COVID-19 test on a patient. The problem is that I even actually have the swabs in my office to be able to collect it, so I don't have the viral transport media to be able to put the swab into. That's one problem. The second problem is that I can send you to the lab, your kid can get tested, but what'll happen most likely is that that sample will be sent out, it'll be frozen, and then it'll get in line, and all of the higher priority tests are going to be run first. So from my understanding at this point, even if I were to send off a test on a child that I suspected had COVID-19, I won't see a return on that result for another week or 2 weeks. And is that going to change my clinical decision making? The answer is no. My recommendations to you are going to be exactly the same. Stay home as long as you're sick, and you know, follow the precautions that you normally would, hand washing, watching your distance, and you know, so testing at this point is not helpful for me. It's not that it's not available, it actually is, but it's just not something that's going to be very valuable for me right now. We talked a little bit also about the availability of having testing in our offices.
Correct.
Yeah, so just like we currently run rapid flu tests, rapid strep tests in our office, there is a capability that is becoming currently available of being able to do rapid COVID-19 testing in somebody's office. You have to, it's being done, I believe, by Abbott Laboratories, and if you already use an Abbott product to do rapid testing in your office, you have the ability to do that if you can get your hands on some of those cartridges. Unfortunately, in my office and a lot of other offices, this is not the system that we currently use, so this type of testing is not going to be very available to us. We could switch testing modalities, but there's going to be a great amount of cost associated with that, so I need to take that into consideration as well. So there's a lot of different parts to determine who's going to be able to do testing in their office, who to send over to the hospital to get testing done.
Thank you. Thank you for touching on that. And also, a lot of parents are on high alert with COVID-19. We are still in allergy season, and flu season, it's kind of hit and miss here and there, but it's not completely over. And so with the weather changing, colds, so as a parent, how can we stay grounded when our kid is having a cough, having a temp, runny nose, instead of panicking and jumping on the my kid has COVID-19 bandwagon? How can we stay grounded?
Great. So I think one of the fortunate things about COVID-19 is that so very, very few children are being significantly impacted by it. So I think as a parent, that should make you feel a lot better, you know, that even if they were to contract SARS-CoV-2, that their symptoms are going to generally be a lot milder. It may be more like a bad flu than anything else. Complication rates are far less than in the adult population, and certainly mortality is a lot less than the adult population too. So quite honestly, when parents bring their concerns to me regarding their child who's running a fever, who's coughing, who has a lot of the symptoms that we typically see all year round, you know, one of the things I'm going to be doing is, you know, trying to tease out information that would point one way or another whether or not it's coronavirus or not, or one of the other coronaviruses, and then you know, kind of making sure that your kid doesn't look like they're severely ill, making sure that they look well hydrated, you know, the typical things I'm going to do with pretty much all the germs that are out there right now, and then make a decision and come to a consensus with the parent about what the best course of action is. So for a parent, I think that they just need to take into consideration the mild nature for most kids when it comes to COVID-19, the fact that there are other germs out there that are circulating. If you have a concern, get with your provider. They can walk you through whether or not this is something that you need to be concerned about and instruct you on the things to watch for. We do that a lot in our office, is that this is what you need to watch for. this is what you need to contact me back about, and then go from there. So I think just having that information of what to watch for is very empowering for parents. And if you have a question about that, get with your provider.
Correct. How about children who have asthma, heart murmurs, or other underlying health conditions?
Yeah, so this is the part where I'm going to say that, you know, the information that we have right now is very limited. It is changing on a daily basis. Most of what we are trying to extrapolate into children, or what we're pulling out, is from the data from adults. You know, so when it comes to children, we assume that with certain underlying chronic conditions that there will be a higher risk, just like there is for seasonal flu, just like there is for some of the other organisms that we see. So children who have asthma, chronic lung disease, are on oxygen, all of these conditions can put them at slightly higher risk, but as a general rule, most children who are infected seem to be weathering it a lot better, faring better than the adults are.
Now, let's talk about quarantine. There's different variables when it comes to quarantine. We hear quarantine 2 weeks, some 3 weeks. What's your take on that?
So the recommendations that are being made come out of the CDC, and they're going to be based on adult recommendations primarily, you know, as far as returning to work, returning to society. That the current recommendations, which I'm also pretty much using for kids too when parents ask me, you know, so the current recommendations are that if you suspect that you have COVID-19 or that your child has COVID-19, in order to return to work, to return to daycare, we like to see a couple of things. One of them would be 3 days without fever. And then what we'd like to see is the symptoms are improving. And then the third part of that is to make sure we're at least 7 days out from when the symptoms first started. So if we've met all three of those criteria, then you can consider, you know, going back to wherever it is that you need to go back to, or returning to daycare at that point.
Okay, great. That is all my questions. I'll see if there are any questions on Facebook. Do you have any other remarks, anything that you feel like we missed, or anything that you want to share with the viewers?
No, I think I just wanted to give a shout out to my medical colleagues that are out there. You know, everybody I think has been inundated with information. You know, this, as an MD, this whole scenario that's been unfolding has pretty much been like a bad car wreck. It's really kind of hard to take your eyes off of it. And so from a medical standpoint, there's been an enormous amount of information that has been generated from multiple sources. And I think trying to get through all that information, tease out what's important out of that information has been probably what every provider in Enid has been doing, you know, and so I just wanted to acknowledge my colleagues, you know, for staying on top of everything and putting into place in either their office setting or in the hospital the appropriate measures we're not even seeing a peak in cases in Oklahoma yet. That probably won't happen for another couple of weeks, and so there's been a lot of changes that have been made, and education, and, you know, a lot of things on our part that we're trying to sort out, in addition to what everybody else is sorting out, which is what's going to happen to my business, you know, how are we going to pay staff, you know, that kind of stuff. These are all things that your providers are also considering. So we're all in this together. So yeah, right. So we'll get through this all together as well.
Well, thank you very much, Dr. Switzer, for being here. And thank you very much for all the medical teams in our community. We know that you guys are working overtime with learning and inputting different procedures and still giving care to patients. And thank you very much for all that you are doing. And this is our update, our Pediatric Edition. And join us for tomorrow. We will be at the testing pod here in Enid. We are planning to do our COVID-19 at that time. The time is at 8:30. If that changes, we'll be posting it on our page. Thank you.